LIEN was formed in 2004, and we are a network of community legal clinics, anti-poverty groups, affordable housing groups, environmental and social justice groups. LIEN represents over 60 member organizations across Ontario. As a network representing the intersection of interests related to low-income consumers and energy and sustainability, LIEN's focus is on reducing the energy bills of all low-income consumers and ensuring that they're provided with the opportunity and the tools to better manage their energy bills. LIEN's annual conference is an opportunity to celebrate our achievements, but also to work together to help advance our vision to end energy poverty in Ontario. Climate change disproportionately affects vulnerable and marginalized communities and will continue to exacerbate energy disparities. As the planet heats up, extreme weather is felt unequally, both across and within countries. Rising temperatures and extreme heat events create and exacerbate health inequities. The elderly, children, and people with chronic diseases or those who are on certain medications are the most sensitive to heat. Extreme weather events are expected to increase in the coming decade, but Canada continues to remain unprepared. David Phillips, the senior climatologist at Environment Canada, recently warned that the recent heat waves are really a dress rehearsal, almost the opening act of what we're going to see more of. Extreme heat events introduce multi-stress vulnerabilities affecting people's health and well-being, financial situation, mobility, social relations, and access to basic services. And reducing heat vulnerability requires government responses and community-level responses, cutting across a number of different sectors, including public health, emergency management, social services, critical infrastructure, and housing. But it also requires an equity-based approach to all decision-making.
We've replaced surfaces, natural surfaces of vegetation and water. We've replaced with man-made surfaces like asphalt and paving that actually absorb the heat and then re-emit it. So we don't get a cooling overnight, for example, and actually urban areas can become some 10 to 15 degrees hotter in terms of surface temperatures. And particularly at night, this can be a problem because we get these prolonged heat waves. So we don't see the temperature go down overnight. There's no respite. People cannot ventilate their houses and cool.
First of all, to note that in a global context, Canada is warming at nearly twice the global rate. So when they talk about 1.2 degrees C warming, or that's happened already globally, that means in Canada we're averaging probably well over 2 degrees C warming, and northern Canada is warming at 3 to 4 times that. Extreme events that we're experiencing already, such as Hurricane Fiona a few days ago, and now Hurricane Ian on its way. These things are projected to intensify in the future, more of them, more often.
The good news is that heat-related illness and fatalities are avoidable through appropriate adaptation and emergency response and kind of collective action.
From the United Nations Disaster Research Resistance Program, it notes that there is no such thing as a natural disaster, only natural hazards. And the things that make them disasters are the combination of choices of where we inhabit, what we build, what research we do, and the combination of hazard exposure and vulnerability lead to the death, loss, and damages. So the key things that we have to work on is reducing exposure and vulnerability. What we can say is that from our study of climate resilient communities, that some communities in Canada have prepared high-level adaptation plans, but few have actually detailed implementation strategies, and emphasize that, with established funding to do that. The Indigenous communities are leading in climate change adaptation, a lot of work being done, and the expert community overall has provided the tools to develop and implement plans. And the real problem is that local governments lack funding, and they lack the guidance from senior governments to plan to be resilient.
Climate change is the biggest threat to health of the 21st century. But we're really speaking out, for example, in favor of active transportation and active transportation infrastructure, because people benefit directly from engaging in more active transportation. And then, of course, we're also reducing emissions. And likewise, by reducing emissions immediately, we can have immediate health gains from the reduction in air pollution and air pollution related illness.